Hello guys, welcome to my YouTube channel. Hope you are fine. We are talking about what is the GP appointment, online appointment, emergency appointment. Career service and planning for a crisis. The guide explains what the mental health crisis service are available, how they can help when to access them. It also explains how to get plan for crisis. If you feeling the crisis right now, see to emergency advice. Whatever the emergency GP appointment, your local GP surgery should be able to offer you an appointment to see a doctor quickly if you need urgent support for your mental health. This is often called to emergency appointment for the same day appointment. What should I make an emergency appointment? How could it help me? How can I see access it? Why should I make an emergency appointment? If you need urgent support for your mental health, but you feel able to keep yourself safe for a short while until your appointment, how to get a help me? An emergency appointment involves seeing a doctor quickly. Usually, the first appointment with the available doctor is if it's not with your regular GP and you like to see them too, you can ask your surgery about booking a follow-up appointment. What might happen at the appointment? If your appointment, the doctor might ask about what happening for your currently, including your moods, thoughts, behaviors, and any recent event that have contributed to you feeling in crisis. Provide the information and advice, for example, about local services you can contact yourself, prescribe or adjust medication which might be to help you cope with symptoms you experience or to try reduce side effects that contributing to how you feeling. Prefer for more support, to example the crisis team, CRHT, or potentially for the hospital admissions. For more information to take a GP, what might happens to appointment, that and whatever the confidential, see our guide to seeking help for a mental health problem. How can I access it? If you need an emergency appointment, you should be offered one as quickly as possible. Although you might be asked for wait for doctor to call you back before being giving appointment time, you can go to doctor surgery in person to ask for appointment, but they won't usually be able to see you straight away. So it's often best to contact them before going in. If you need an appointment outside regular opening hours, you might be doctor at your nearest surgery, or your might be asked to visit another surgery in your local area. You can get urgent help from GP survey without being registered as a patient, although you might be need to registered as a temporary patient if you need the treatment over more than 24 hours. Yeah, emergency GP appointment in England. To access this service in England, you can contact your local GP surgery. You can find GP service fee surgeries on the NHC websites. If the surgery is closed, you should hear a record message explaining what to do. Do you call 111 instead? Call 111, a free 24-hour NHC helpline that can help you access local services including GPs. Find about more the services including optional for people that hearing the difficulties on the NHS website. Emergency GP appointment whiles to access this service. Wales, you can contact your local GP surgery. You can find GP surgery on the NHC Direct Wales website. If the surgery is closed, you should hear a recorded message saying what to do. Use the expressional blue instead. Contact your local out of hour services to find their details. See the health in the Wales website. Call 11 a free 24-hour NHC helpline available in the some areas of the Wales. Find out more about the services including where this service is available and the option for people the hearing difficulties on the NHS 111 website. Call NHS Tracked Wales on 24-hour NHS helpline available in areas of Wales. The NHC but 1 is available. The service, the planning of the crisis, accident or emergency. The information was the pollution. Hope you will like the video, boss. If you feel unable to keep yourself safe and need intermediate help, especially if you think you are at risk to acting, uh, so the, or you have seriously harmed yourself and need medical attention, how could it help me? Some AE and departments have lessons, prescriptive team specialists for help, mental health that you can risk to see. If there is not a elevation respiratory team, A and staff may contact other local services such as crisis team. The lesson respiratory team or mental health team might make a individual assessment for your mental health needs. Something's called respiratory evaluations help keep you safe for the short term. Prescribe medications to help you cope with the symptoms you may be experiencing right now. Put you in contact with other crisis services such as a local crisis team. Decide whatever you can go home or if you need admit to hospital. It detect to the crisis team at the A and E and got some help. Also, I was left to site on my own 2 hours after waiting. I was put in touch with the right people. They come to see me while I was there, and I had a physics evaluation. They can vary depending on the situation and the hospital you go to, but might including being asked to register stuff, might ask for details you like name and address as the reason why you have to come. A being associated something called tiger, a medical professional should talk to find out the happening and how best to help you. It could help if you mention that you experience a mental health crisis and ask to see the lessons physical team. Having to wait A&E to department can be very busy, and unfortunately for you might have to wait for some time. Even tough you need to help urgently, it could be helpful to ask someone to trust to wait with you if this is an option for you. Being threatened transfer to set hope. You might be giving treatment in AE and transferred to another part of the hospital as a mental ward to be told you to go home. If you can be turned away from AE, you can be turned away from AE if you need to emergency treatment or prevent from the coming back in future. When you arrive in AE, you should be accessed by the clinical member of the staff, but you might not be get treatment if it's not an emergency. For example, if professionals believe you could wait to get help from GP instead. Hope you guys like this video. Hope you guys like video. We will meet you in next video. Goodbye.